Hi, I'm Dr. Brady, Denver's #1 Concept provider. In this short video, we're going to review the 3 things to help your posture right now. When it comes to your posture, it is so important to understand what the consequences are when your posture isn't ideal. Everybody notices at first is the feelings of aches and pains in your neck or even your low back. But over a long time, it starts to see larger functional issues such as headaches, migraines, numbness and tingling down your arms or legs. And if these don't get taken care of, we see more severe symptoms start to develop, and they present in organ dysfunction. That can affect digestion, your hormones, suppressed immune system, and even reproductive organs. All these things can happen because your spine protects your most important organ system, your nervous system. When your posture isn't correct, this causes misalignments that can put pressure on your nervous system and disrupt how your nerves are ultimately sending and receiving information. The first way to improve your posture is actually to be more conscious of all the repetitive things that you are doing on a daily basis. This includes how you sleep, how you are sitting at a desk for hours on end, and how you're driving in the car. And I know everyone has one of these, and it is how we are looking at these phones for hours every day. The daily habits that you are doing actually add up to these small micro tremors. While it might not seem like a lot in the moment, these small things add up to be detrimental to your overall posture. So let's start with sleeping first. I get this question all the time. Hey doc, how should I be sleeping? And the answer to this is not a cookie cutter answer for everybody, but there is a general rule to follow. And the answer is this: you should put your spine in the most neutral position possible for those extended hours of the time that you're asleep. Sleeping on your back will keep your hips even, your low and mid back neutral, and prevent rotation in your neck. The pillow to be used should be supportive, but not to put you in a forward head position. If you are a side sleeper, the way you want to keep your spine neutral is by placing a pillow between your legs. This is so important because without a pillow, people will often roll their pelvis over, which causes twisting and torsional forces on the low back, which can cause damage to the tissues and cause misalignments and muscle imbalances. Once your low back is neutral with a stacked pelvis, the neck is also important to support at the right height. Too thin of a pillow will cause one side of the neck's imbalance to be shortened and the other lengthened. And with too thick of a pillow, it will do the opposite. The hours spent in the wrong position will change the muscle length and can add up to causing postural issues if you don't keep your spine neutral. And lastly, the last position is actually stomach sleepers. It is not recommended to sleep on your stomach due to the cause of the low back pain and the cause of the rotation on your neck. Now let's review desk sitting. Many people work desk jobs, and there are 2 things to keep in mind to avoid a poor posture. The first is the compromised position of having a forward head posture. This often happens when the computer monitor is at a lower level than your eyes, which forces you into a lean forward position. This is bad because for every inch your head moves forward, it actually adds an extra 10 pounds of weight for your stronger trap muscles to activate and ensure that your head doesn't completely fall forward. This position adds up to causing your shoulders to be chronically tight and your upper back to actually round over time. Moving your monitor height up to eye level or above might do the trick, which will actually bring your head back and stacked over your shoulders. Too low of a monitor brings it forward, at the right level brings your head back, and above might actually be best to bring that backwards. The second tip about sitting for a long time at a desk job is actually the imbalances that it causes when you're in that bent forward position at a desk. Typically, the iliopsoas or hip flexors shorten because they're bent for a long time. Sitting for too long will cause an imbalance and a rotation in the pelvis. Some tips that you can do here is to take regular walks or get a standing desk so that those hips can be open and muscles will be balanced so there's not a misalignment in the spine causing postural issues. Driving a car is much like sitting at a desk for hours on end. Focus on keeping your head back and those shoulders from being rounded. A tip that you can do is actually use the headrest as a cue for you to actively keep your head back. Touch that head to the back of the headrest to keep that head stacked over your shoulders. Lastly are our phones. This causes way too much forward head posture, which weakens your neck muscles and causes imbalances in the muscles. we are starting to see a large generational gap in geriatric patients compared to pediatric patients when we take x-rays. The older population didn't grow up with cell phones, so they didn't have those hours spent of just staring straight down at their phones over and over again. So when we take x-rays of them, they have a natural, beautiful curve already still in their neck. But when we take x-rays of kids, we are already seeing a loss of that curve, straightening of the neck, and even a complete reverse curve, which has been caused by those repetitive hours of that poor posture, looking straight down at their cell phones or tablets. So instead, do this, and this will help save that posture in your neck from going forward, causing the tension on those traps and everything. Instead of looking straight down like this, doing emails and phones, place your arm underneath and keep that phone at eye level, keeping that neck back and the head stacked over the shoulders. The second way to improve your posture is some exercises to strengthen or some stretches to loosen up those tight areas. There are two very important concepts that you must understand to know what muscles are tight and what muscles are weak or turned off. And these are terms called upper cross syndrome, which is related to the neck, and lower cross syndrome that is related to the low back. And what happens with all those positional things you do on a daily basis, this is a chart that you can reference to understand what muscles are tight and what muscles are weak or turned off. So let's review how to strengthen areas and how to stretch or relax those other areas. In upper cross syndrome specifically, there are two areas that are tight and there's two areas that are weak, and they create an X. So the areas that are weak or inhibited, meaning turned off, are the deep neck muscles. Those are the ones that actually keep your head back and up properly. And then second, following that X, is the lower traps or the serratus anterior area. So we need to help strengthen those areas. Now the areas that are tight or facilitated or chronically most likely what you feel in pain, and again they create an X, is the SCM, the sternocleidomastoid muscle, as well as the pec muscles. And then also creating an X up to the top are those chronically tight upper trap fibers and also levator scalp. This is the number one area where people feel the pain is up through their neck because it's so chronically tight. And with lower cross syndrome, it is the same. There's two areas that are chronically tight, and then also two areas that are weak or inhibited, meaning turned off. The ones that are turned off or weak that we need to start strengthening are the abdominals, as well as creating that X formation down in the glutes, the medius, minimus, and maximus muscles. Now the areas that are facilitated or tight that we need to actually stretch are the thoracolumbar extensors, so that lower back, as well as the hip flexors. And we talked about what happens when you sit for a long time, that shortens the hip flexors, the iliopsoas. Those are chronically tight, so we need to stretch them open. So these are the strengthening and stretching exercises that you want to do for upper cross syndrome specifically. First, let's strengthen those weak areas, the deep neck muscles and the lower trap muscles, to strengthen the neck, which actually keep your head back and stacked over your spine and shoulders. What I want you to do is chin retractions. Simply tucking that chin straight back and feeling those muscles activate. These will help pull that head back. So hold that tucked chin for 1 split second, relax, and then go back into another hold. Make a double chin basically is how you do that. Second, lower trap muscles is how to activate those are simply some pulling in an upwards to vertical down position to help activate your lats like a pull-up. Now stretches that you want to do specifically to stretch the traps and stretch the pecs. Do some 90-90 doorway stretches where you bring your arm 90 degrees to your armpit and your elbow, lean into a door frame that will open and stretch those pec muscles. And second, you can pull that arm down and look away. We'll stretch those neck muscles for those specifically to help relax those for you. So for lower cross syndrome, these are the stretches and strengthening exercises that you want to incorporate to help that lower back posture. Now remember, from long hours of sitting, whether at a desk or in a car, that shortens the hips. So we need to stretch or open them up. Best exercise that you can do today to fix that is go into a lunge position. That opens up the hip flexors here. Now very important not to compromise that low back. Do not lean back into this. What you want to do is tighten the core and actually lean forward. That will open that hip flexor there. Make sure you do both sides. You can hold this position for 8 to 10 seconds, coming off of it and then going back into it, into a deeper stretch, again holding for a few seconds. Now the strengthening exercises that you want to do is primarily for the abdomen as well as the glutes. The first strengthening exercise to activate the glutes is go into a glute bridge, simply raising the glutes and holding a constricted motion there in the glutes to strengthen. Many variations, whether 2 legs or 1 leg even, into that position will help the glutes become strengthened. Next you want to strengthen is the abdomen or core. That can simply be performed from an ab plank, making sure the belly button is tucked and the pelvis is rolled so that you have good posture in that position. Simply hold a plank for 10 seconds at a time if that's all you can do, and then progress further with that. The third and final tip for you to improve your posture is to have postural x-rays taken and analyzed by a Concise provider to ensure there is not a misalignment that is causing your poor posture and preventing you from getting lasting relief. While the first 2 tips can be implemented for everybody, those alone may not totally resolve the poor posture you might have. Often what x-rays will reveal is the root cause of why somebody has poor posture. And not until that misalignment is mechanically corrected can they obtain lasting correction in feeling, function, and posture. I have seen patients come into my office with complaints of pain and poor posture just to find old injuries, including fractures that occurred when they were teenagers. Maybe they were playing football or doing gymnastics. Also, research supports that nearly 20% of people are born with an anomaly in their spine. What that means is basically 1 out of 5 people have a defect in their spine at no fault to their own, and this can drastically affect the movement and positioning of their spine. We have all heard of scoliosis. This is a perfect example of a postural issue that can be developed from both an injury as well as from a birth defect. Gross misalignments need immediate attention to prevent poor posture from occurring, and a Concise chiropractor is trained more than any other chiropractor in x-ray analysis to find the culprit and help both the mechanics of how the spine moves as well as the overall function of the body. Many people don't know they have a misalignment of their spine, and that is why the third thing you can do is to have images taken to know what your spine looks like and how it's affecting your posture. To see is to know, and with that knowledge, the root cause can be located to help change your posture and to help prevent poor posture from ever developing. So in closing, those are the 3 things that you can do right now to improve your posture. Be conscious about the position you're in on all those daily habits that you do day in and day out. 2, focus on some stretches and some exercise you can do to strengthen and stretch or release some tight muscles. And 3rd, get some postural x-rays by a Concise chiropractor to know what is going on, to prevent and to make sure poor posture never develops.